In this video, we will be discussing two oxygen delivery devices, a low-flow nasal cannula and a simple mask. These low-flow devices provide oxygen at low-flow rates that are lower than patients' inspiratory demands.
Indications: nasal cannula, low FiO2 and stable, long-term therapy home care, COPD, cystic and pulmonary fibrosis, carbon and cyanide poisoning. Simple mask. Emergencies: short-term therapy, moderate FiO2, mouth breathing patients, moderate FiO2, operative procedures.
The contraindications for a nasal cannula are as follows: decreased level of consciousness, pneumothorax, nasal obstruction, life-threatening hypoxia or apnea, hemodynamic instability, trauma to the skull, as in a fracture and also the chest, foreign body aspiration. The contraindications for a simple mask are as follows: apnea, needing a higher FiO2, severe hypoxia, uncontrolled vomiting or copious amounts of mucus, upper gastrointestinal bleeding, facial trauma, patient declines, patient cannot protect their airway, and acute myocardial infarction.
Settings: low-flow nasal cannula delivers 1 to 6 liters per minute of flow and FiO2 range of 24 to 44%. The low-flow nasal cannula is best used in patients who need a low FiO2 or patients who need long-term therapy. A humidifier is always used when the input flow is greater than 4 liters per minute. Simple mask delivers 5 to 10 liters per minute in flow and FiO2 range of 35 to 50%. Simple masks are used in emergencies and patients who need a short-term therapy.
Hi Devinae. Hi Jennifer.
Hi, hello.
How are you guys today?
Good, how are you?
Good. So here we have a patient, a 60-year-old male. He has a past history of COPD as well as asthma. His vital signs are stable. He's currently alert and oriented ×4. There are no current exacerbations in his chart, but he is currently experiencing a cold with mild dyspnea. So I'm thinking we should put him on a low flow nasal cannula at about 2 liters per minute at about 20% FiO2. How do you guys feel about that?
That sounds great.
Okay, perfect. Let's go ahead and set this up.
We will be back. Thank you.
Thank you.
Hi, good morning, Mr. Jones. How are you today?
Pretty good.
That's great. My name is Jennifer from Respiratory. Can I please verify your name and your date of birth?
I am Mr. Jones.
Great. We're gonna put you on some oxygen. I have an order from your doctor. We're gonna use the nasal cannula at 2 liters per minute. Okay, any questions so far?
No.
Perfect. Before we start, we're gonna be using this equipment right here.
What is that?
Which is our flow meter. This is gonna tell us the liters that we're using with you every minute. In this case, it's 2. We're gonna adjust it to number 2.
Okay.
We always are gonna make sure that we have our Christmas tree. And the most important thing, our nasal cannula. We're gonna attach the ending of the tube into the Christmas tree. And the most important thing, we're gonna make sure that the prongs are facing our patient just like this. We're gonna go around the ears and adjust the slider. How are you feeling?
Feels comfortable.
Perfect. Okay, Mr. Jones, before I leave your room, is there anything else I can do for you?
No, I just want to rest.
Perfect. We'll be back with you. And before I leave, I have my no smoking sign. And here's you Lycol. Okay?
Thank you.
You're welcome. Have a great day.
Hi Jennifer, how's Mr. Jones doing?
Hello, doctor. I have really bad news. The report is showing that our patient is not getting any better, and the 2 liters per minute are not working.
Okay, so what did you suggest that we do?
I will suggest to use a simple mask.
Okay, I like that idea. How about we put him on 6 liters per minute at about 40% of oxygen? How do you feel about that?
Sounds great. I will report that back to you.
Perfect,
Thank you, doctor.
Thank you.
Come in.
Hello, Mr. Jones. How you feeling?
I'm still short of breath. I don't feel like I'm getting any relief.
I'm sorry to hear that. And there's going to be some changes. We're going to change the equipment that we're using from a nasal cannula to a simple mask. We're also going to adjust the liter flow to 6 liters per minute. And before I start, it's pretty much the same procedure. We're just going to attach the end of the tube into the Christmas tree. Make sure it's a 6. We're gonna lose the strap just a little. Okay, can I please ask you to help me real quick? Can you
Sure.
hold the mask for me? Thank you so much. We're gonna go around your head, and I'm gonna start adjusting the straps. Is this comfortable for you?
Yes, it's fine.
Perfect. Okay, Mr. Jones, we'll be checking up on you pretty soon. Hope you're feeling better.
Great. Thank you.